Hello, my name is Mariela Castillo, and I'll be talking about my case study about a 3-year-old Pomeranian that we should be calling Toto. So Toto was a healthy dog, no pre-existing conditions, no current medications except for heartworm prevention, and he was brought in because his owners noticed that he had been pawing at his mouth and not eating as much. His temperature was taken and he was weighed, and during the physical examination by the vet, he did have a pain response when his mouth was touched or when they were trying to look at his teeth, especially on the right side. And so the vet considered possibly a cut on his cheek or jaw, maybe a fractured tooth, maybe he bit on something hard, maybe periodontal disease since he had not had a dental cleaning, or possibly a broken jaw, although they did not think that was most likely. And so they scheduled him for x-rays and possibly an advanced dental, depending on what was found. And so he was sent home with pain medication, and the next day he was brought in and they did all of the pre-surgical procedures such as a complete blood count and an EKG, and everything was found to be normal besides what he was brought in for. They started the procedure and they took his temperature before giving him his pre-med, which can be tilosol, ace-promazine, diazepam, or some other form. And then they administered an IV in order to help with him and gave him fluids during the surgery. He was put under, and once they were able to get in and see his mouth and his teeth, it was found that one of his premolars had a fractured almost in half, and it was deep, and the vet figured that it couldn't be saved and the best thing for him was to extract it. And so they did take x-rays of his teeth and saw that it wasn't able to be saved, and that extraction was the best. And so they proceeded with that procedure. They administered the block, and the vet was the one who slowly extracted the teeth in order to help him. And once it was out, they did take more x-rays, they sutured him, and they cleaned up his mouth and his face because of the blood. And then everything was noted and recorded, and the doctor called the owner to inform them of what they had found and of the extraction, and gave him instructions such as giving him wet or softened food, and to keep him away from hard toys and stuff that could hurt him. And so he was woken up, he was put in his cage, and a timer was set for his pre-meds and to take off the IV, and he was sent home with pain medications to help. And everything went smoothly, everything was done appropriately from what I know, and I could really tell how they put their knowledge, both the vet techs and the veterinarian, and how they took the knowledge that they learned from all the other classes and put it towards that one patient in order to help him and make the patient feel better. And it was really, really eye-opening and encouraging to see all that. and that'll be it.